to start, if I might, or would you like to start?
Absolutely. We, I know, are joined by some of our colleagues, but if you want to go through your chart.
Well, let me just take up the Patient's Bill of Rights very, very quickly. I was the insurance commissioner in California for 8 years, and the insurance industry puts people behind profits, profits before people, and they're concerned about making sure that they have a healthy group of customers. They don't want sick people. Sick people cost money. So over the years, they've developed a whole set of discriminatory practices to exclude from coverage people that they don't want to take care of because they might be expensive. So in the Affordable Health Care Act, there is what we call the Patient's Bill of Rights that forces the insurance companies to end insurance discrimination. And here's just some of them. Children with pre-existing conditions. An example, my chief of staff. His son was covered by insurance the day he was born. The second day of his life, they discovered that kid had very serious renal failure, kidney failure. Bam, the insurance was over. That family was off their insurance policy, gone, done. No longer. We're talking about, I think, 14 million American children that are going to get covered regardless of what their health circumstances might be. Young adults. This one's close to home. I've got 6 children. Every one of them have passed through that age of 21 when they were no longer on our insurance policy. Most recently, my daughter. 21 years of age, covered by an insurance company for 21 years and 9 months. Day of her 21st birthday, off the insurance policy. We're now talking about every young American 21 to 26 stays on their parents' health policy. She also happens to be a woman. Women are discriminated against in the insurance because they have a pre-existing condition. They could get pregnant. That's expensive. We don't want to cover them, say the insurance companies. No, no. Under the Patient's Bill of Rights, the discrimination against every woman in America on their insurance policy is over. Apparently, our Republican colleagues don't care about these very, very important efforts to end insurance discrimination. We can go on here. Seniors. Who among us doesn't have a pre-existing condition? High blood pressure. You know, juvenile diabetics, type 2 diabetics. Try to get insurance without the Affordable Health Care Act. You're out of luck. You won't get insurance. So the Patient's Bill of Rights, should today's action become law, is repealed. And along with it, the protections that 365 million Americans presently have. No more insurance discrimination. The ability to get insurance is guaranteed. No more discrimination. Yeah, I'm a little passionate about this one because I watched this. I watched this as insurance commissioner. I fought the insurance companies day in and day out as they denied coverage, as they refused to provide the coverage, as they told people they couldn't get care. But the law is in place now. The law is in place, and it's going to stay in place despite the vote today.
And interestingly, Representative Garamendi, we've been reminded, I think, by the general public that, look, the legislature, the legislative body here, Congress, took up the bill, they passed it, went over to the President, he signed it. The highest court in the land, a conservative-leaning court, reviewed it, assumed, made their decision, and rendered a decision that said it met with constitutionality. People are saying, go forward, move on, get to the issues that now have got to be resolved, and that is the economy, creating the jobs, producing the post-recession responsiveness that people so much require and deserve. And that's where they're at. We've been joined by Representative Eleanor Holmes Norton, who has joined us. Representative, thank you for joining us in the